Stay the fuck away. Stay the fuck away. Stay the fuck away. Stay the fuck away. Hello again, everyone. Sean Patrick here, whether you like it or not. So now, before we do the V-hack, oh, right. I had my imaginary assistant, Sandy, make up this really nice sign. It says virtual hugs and kisses, and the first letters are all big and such so that you can tell we're not referring to the Public Health Agency of Canada. Yeah. And so we put some hearts down here and some flowers over here. And what the hell's this going on over? Whoa! Oh my goodness. No, I was not talking about that kind of hugs and kisses. Imaginary children might be watching this too. Oh yes, tee-hee. It's me the parents are coming after. Anyway, an update on Edmonton's Plagenspiel, sponsored by stupidity. Just like the coronavirus, it's everywhere and contagious as hell. After I did my bit last night, something wasn't sitting right with me, so I went back for another look. What was confusing was that the National Post had said 11 Alberta healthcare workers, plus Dr. Alan Wu, had tested positive, and CTV Regina said that 11 Saskatchewan healthcare officials, including Dr. Wu, had contracted it. But nobody mentioned the other provinces' healthcare workers, and the number 11 seemed too similar. So I went looking, and here's the most recent things I can find. As of March 27th, according to the National Post, 24 of the 72 attendees have tested positive. That's a third of all of the attendees so far, never mind the fact that doctors came from across the country to go to this thing, and then returned home, and were hopefully at least as considerate as 3 doctors from Manitoba who reportedly went into self-isolation immediately. The 3 Alberta doctors who went back to work had apparently been in contact with 58 patients and 97 other healthcare officials. So my first set of virtual hugs and kisses goes out to anyone who thought they could depend on any of the 72 healthcare professionals who just had to go curling. Next is none of it, who, as of writing this piece, still has no confirmed cases. A special shout out to my friend Aaron and his family who live there. Virtual hugs and kisses for you all. So to finish up the V-hack, while continuing research on the Plagenspiel, I found something else. After attending the Pacific Dental Conference in Vancouver in early March, Dr. Dennis Vincent died of the virus. I couldn't find the date of death, but he was reported to have gone back to work and was still seeing patients a week before his death. So virtual hugs and kisses to all of the patients that saw him in between. Okay, so the addresses. Something I liked about both of the federal addresses today is that the officials have started responding to questions with, yeah, we don't know, but, and then reinforcing the rules and doing their best to be supportive. The only thing that really stuck out for me, besides the obvious about the Prime Minister's address, was when, in reference to the 75% wage subsidy, he said there will be stiff and severe penalties for trying to take advantage of the system and your fellow Canadians. Well, you know what? Everyone who's going about their business like this just isn't happening is not only taking advantage of Canadians, they are literally putting lives at risk. Let's try to put this into perspective. Okay? 80% of all people, according to the WHO, will contract this disease. Most of those will only have mild or moderate symptoms. And even if you only experience mild symptoms, it can still cause permanent respiratory damage. You can also have it and transmit it without ever showing symptoms. That means that if you're hanging out with 4 of your friends, probably only one of you didn't have it to start. Likely, you're all infected now. And 80% of Canadians is more than 30 million people. Then, about 10% of those people will need hospitalization. That means over 3 million people here in Canada, all at once. Does anybody here see the problem? No country has ever had access to the resources needed to hospitalize what works out to about 8% of the entire country's population at one time. How many of those people will be frontline and other essential workers that we need? And then about 2% of people die from it. Now, our number was slightly lower than that last I checked at present, but that does not include when breakouts happen in long-term care facilities, hospitals, shelters, and all other close quarters living arrangements, which is what we're seeing now. So before cluster outbreaks, we were supposed to expect about 60,000 deaths Canada-wide. Chances are, if we don't all start taking this seriously, that number is going to be way higher. And by the way, using those percentages from the WHO is a mid-range estimate, which leads me to the question, don't Canadians have a right to know that that estimates are now suggesting we stay in lockdown for as much as 3 months? No. Look, if we all listened to the rules in the first place, that would not have happened. We wouldn't have to stay in for anywhere near as long. But the virus requires close contact to transmit. And Dr. Theresa Tam and many other doctors around the world have said if we all self-isolated for 2 weeks, the virus couldn't be transmitted and it would die. Not Canadians, not people, the virus. This question and others asking about making plans for the future made me realize why I'm dealing with this much better than most people. With my health issues, I've not had any way of knowing what to expect for years. Every day when I wake up, it's different. On rare occasions, I can do what I need to take care of myself and my producer and spend an hour gardening. But more often than that, I have to spend an hour in bed doing stretches just so I can get to the washroom. Most of the time, it's somewhere in between. I haven't been able to make solid plans for years. Every day starts with hopes, and all I can do is see how it plays out. When I'm in serious pain, all I want to know is when it's going away. But I don't get to have that ever anymore. The reason that the reason they say we're looking at a possible 3 more months of this is because people are not listening, not staying home, not physical distancing. So if everyone in Canada actually got themselves set up by the weekend, the end of the weekend, and lock up, this could be over in way less than those 3 months. And we'd be putting far less people at risk. Every cost in every possible way would be so much cheaper. Wouldn't have to worry about hospital beds, PPEs, and food. Yes, worrying about food. If people keep ignoring the health officials, it's going to take way longer. And all the numbers I just gave you will be a best case scenario. So to sum it up, superheroes, they're clearly not listening. So why would vague estimates help? All right, here's a little tidbit of news abroad. Today, the UK announced that it is releasing 35 pregnant inmates. That means that they now have 79,967 inmates desperately trying to get knocked up. All right, so tomorrow I may not be able to do my show because I will have to go out for groceries. This will be my first grocery run in 2 weeks, and the second time I've been in public in the same time frame. The last was Monday when I shipped a package for my wife. As I said then, everyone respected the physical distancing rules, and the only things I touched that anyone else had was the hand sanitizer and the receipt. But tomorrow's not going to be the same. Right now, I most likely don't have the virus. But I'm fucking scared because of the asshole superheroes and not knowing what caused my already existing health problems, which has been suggested several times that it could be immunodeficiencies. I could die for fucking orange juice tomorrow. In fact, that's how it is for all of us for the foreseeable future. So stay the fuck away from each other and wash everything. A lot.